Jim Anderton.
Speaker, my question is to the Associate Minister of Health and asks, how many times in 2009 did he meet with representatives of the liquor industry, and what were the dates of these meetings?
The Honourable Peter
Mr. Speaker, during 2009 I met with representatives of the liquor industry 4 times, on the 5th of May, the 27th of May, the 5th of August and the 7th of September. I also attended 3 functions sponsored by representatives of the wider liquor and hospitality industries. In contrast, I met with officials and non-industry related groups on a mere 41 occasions.
The Honourable Jim Anderton.
Mr. Speaker, did he have any concerns as the Associate Minister of Health in charge of the government's alcohol policy that there could be a perception that he was overindulgent to the liquor lobby by meeting with them 4 times in 4 months and being hosted by them on a further 3 occasions over 6 months?
The Honourable Dr.
Mr. Speaker, I would have thought on the basis of the figures that I gave, the concern that could be expressed was that I was paying less attention than I should to their interests.
The Honourable Jim Anderton.
Mr. Speaker, when his private health secretary wrote to Professor Doug Selman, Professor of Psychiatry and Addictive Medicine, Director of the National Addiction Centre and expert psychiatrist on the Expert Advisory Committee on Drugs, that he would not agree to meet with him because, quote, he was aware of his thoughts on alcohol, end quote, is he seriously suggesting that he was not aware of the thoughts of the alcohol industry when he met with them on 7 occasions at the same time?
The Honourable Peter Dunn.
Mr. Speaker, I am well aware of Professor Selman's views. Indeed, they were stated on television last night that alcohol should be treated as a Class B drug and people shouldn't drink at weddings. I meet with a lot of people on alcohol-related matters over a range of issues. I've met with the United Nations Alcohol and Drug Programme, the World Health Organisation Global Alcohol Strategy. I've visited various treatment facilities up and down this country. I've actually worked in this field for over 30 years.
The Honourable Jim Anderton.
Mr. Speaker, if the Minister understands Professor Selman's thoughts on alcohol so well, could he comment on Professor Selman's 5+ solutions and 10 things the alcohol industry won't tell New Zealanders about alcohol in the 38 public meetings he has recently held throughout New Zealand?
The Honourable Peter Dunn.
Mr. Speaker, I'm well aware of both the 5+ plan. I can't recall the precise details of the 10 things that he alleges the industry won't tell people, but the presentations are widely available. I've read them frequently.
The Honourable Leanne Dalzell.
Speaker, is it correct, as reported, that he was, quote, amused by the doctors' and nurses' support for the 5+ solution? And if so, what is funny about the annual rate of 1,000 alcohol-related deaths each year? Or is he underplaying it because the statement identifies that the tactics being employed by the liquor industry are the same as used by the tobacco industry?
Mr. Speaker, I'm not underplaying in any way the social and economic consequences of the misuse of alcohol. Indeed, I spent last Saturday evening out with the Wellington Central Police and at the Wellington Hospital Emergency Department viewing those very things.
Point of order, the Honourable Leanne Dalzell.
Mr. Speaker, I seek leave to table an historic opportunity to change New Zealand's heavy drinking culture, a public statement by the doctors and nurses of New Zealand supporting the 5+ solution.
Leave is sought to table that document. Is there any objection? There is none. Point of order, the Honourable Jim Anderton.
Mr. Speaker, I seek leave to table 10 things the alcohol industry won't tell you about alcohol and the 5+ solutions prepared by Professor Selman.
Leave is sought to table those documents. Is there any objection? There is none. Question number 6, Keith Locke.